Welcome to the future.
Welcome to 1337, the future of podcast of longevity. I'm Sophia, your host, and I explore the science of living longer.
And I'm Max, diving into health hacks and ageless living.
We're here to uncover the secrets to a vibrant, extended life.
Absolutely. And today we are taking a deep dive into something really fundamental to that for you.
Yes, the interconnectedness of your bones, your muscles, and your overall well-being. We're going to be drawing from the insights of Dr. Vonda Wright, a leading orthopedic surgeon and longevity expert who you shared with us.
That's right. Dr. Wright has a really unique perspective coming from a background working with elite athletes and now applying those same principles to help everyone live longer and stronger.
Exactly. And our mission today in this deep dive is to unpack the key takeaways from her expertise without getting lost in the weeds, so to speak. We don't want to bob you down with overly technical details, but we do want to get you the knowledge you need quickly and thoroughly. So are you ready to dive in?
Absolutely. Let's get started.
Okay, great. So one of the things that really struck me about Dr. Wright's work is how she emphasizes the importance of our bones.
Yeah, she's really passionate about that. And for good reason. In the U.S., at least half of women and a significant portion of men will experience osteoporosis.
Osteoporosis, right? That's characterized by low bone density, and we all know that can lead to fractures, which are obviously a huge concern.
Absolutely. And the statistics there are pretty sobering. Something like 30% of hip fracture patients die from complications.
Wow, that's a really scary statistic.
It is, and it highlights just how serious bone health is.
For sure. But what's interesting is that Dr. Wright also points out a less obvious link between low bone density and higher rates of cognitive decline.
Oh yeah, that's a fascinating connection.
It is. It's not something that I immediately think of when I think about bone health.
I know, right? It's not intuitive, but when we connect this to the bigger picture, it starts to make more sense.
So how are bone health and cognitive decline connected?
Well, bone isn't just this static framework like we might imagine. It's actually a metabolically active tissue that's constantly communicating with the rest of your body.
Oh, interesting. So it's not just sitting there passively.
Not at all. And Dr. Wright's research indicates that bone releases proteins.
Proteins?
Yes, and one key one is called osteocalcin.
Osteocalcin, okay.
Now, studies suggest that osteocalcin can actually cross the blood-brain barrier, which is pretty amazing.
Wow, so it can actually impact the brain directly.
That seems to be the case. And it may even stimulate the growth of new neurons.
Really? So it could potentially play a role in counteracting age-related cognitive decline.
Exactly. So when your bone density is low, it seems like this crucial communication network can be disrupted.
That makes a lot of sense. So taking care of our bones could actually be a way to protect our brains as well.
It seems so, which is why Dr. Wright is so passionate about this topic.
Absolutely. Now, another thing that Dr. Wright talks about is how we typically build peak bone mass until our late 20s or early 30s.
Right, that's when our bones are at their strongest.
But then for women, bone density can start to gradually decline, especially around menopause.
Yeah, because of the drop in estrogen.
Right, but what I found really encouraging is that Dr. Wright stresses that this natural decline doesn't automatically condemn us to osteoporosis and fractures later in life.
Absolutely, our lifestyle choices play a huge role.
That's really empowering to know that we have some control over this.
It is, and it raises a crucial question: what kind of lifestyle habits are most effective at maintaining strong bones throughout our lives?
Right, because it's not just about what happens during menopause. It's about setting ourselves up for success throughout our lifespan.
Exactly. And Dr. Wright's observations of master athletes offer some interesting insights here.
Oh, that's cool. What did she find?
Well, she found that athletes who consistently engage in bounding sports, activities that involve impact like running and basketball, maintain remarkably high bone density even into their 80s.
Wow, so it's not just about genetics.
Right. It seems like this mechanical loading, this impact, is just as vital as our genes in determining bone strength.
That's really interesting because I often opt for the low-impact versions of exercises.
Yeah, well, maybe it's time to rethink that strategy.
Yeah, maybe so. Now, Dr. Wright also highlighted some other surprising factors that can affect bone density at different stages of life.
Like what?
Well, for instance, she mentioned that young women who are overly focused on achieving a very low body weight might not be building sufficient bone mass during their peak bone-building years.
Oh, right, because of inconsistent menstrual cycles and low estrogen levels.
Exactly. And then there's the impact of breastfeeding.
Yeah, that's a big one. Dr. Wright points out that women can lose a significant amount of bone density, up to 20% in the first 6 months of breastfeeding.
Wow, 20%. That's a lot.
It is, and it underscores how important it is for breastfeeding mothers to ensure they're getting enough calcium.
To support their own bone health and enable them to rebuild that density afterward.
Precisely. Dr. Wright recommends around 500 milligrams of calcium a day, ideally from whole food sources.
Got it. So it really sounds like our bones are in a constant state of adaptation.
They are. They're responding to the stresses we place on them, or the lack thereof.
Exactly. And Dr. Wright really challenges that old notion of bones as inert structures. She describes them as these master communicators within the body.
I love that analogy. It really captures their dynamic role.
It does. And if we go back to that example of osteocalcin, its influence isn't limited to the brain.
Right. Dr. Wright explains that osteocalcin also plays a role in regulating insulin sensitivity in the pancreas.
Oh, wow. So it's helping our muscles take up glucose from the blood more effectively.
Exactly. And in men, it can even influence testosterone production.
Wow. So bone health impacts so much more than just fracture risk.
It really does. It's all interconnected.
It is. So what does all of this mean for our listeners in practical terms?
I think the main takeaway is that we need to start prioritizing our bone health much earlier than we might have thought.
It's not just about preventing falls later on.
Right. It's deeply intertwined with our brain health, our metabolic health, and our overall vitality as we age.
And Dr. Wright mentioned a critical decade for establishing good bone health.
Yeah, that's roughly between the ages of 35 and 45 for both men and women.
Okay, so that's a crucial window of opportunity.
It is. It's a time to establish healthy habits that will really impact our bone and muscle health as we move into later life stages.
For women, estrogen levels start to become more unpredictable during this time.
Right. And for everyone, it's a good time to get baseline health markers checked, including testosterone levels in men.
And to prioritize both mobility and resistance training.
Absolutely. Building a good foundation of muscle mass during this period, while hormone levels are still relatively supportive, sets us up for a much stronger and more resilient future.
It's like making investments in our future health.
Exactly, but instead of financial capital, we're building a reserve of muscle and bone.
I love that analogy. And speaking of muscle, Dr. Wright is a huge advocate for its role in longevity.
Oh, she places it right alongside bone health in terms of importance.
She does, and she has this really empowering quote, "Your body will always rise to the strategic stress you place on it."
I love that. It's so encouraging, especially for those of us who might feel like it's too late to start making a difference.
Exactly. Dr. Wright emphasizes that it's never too late to start building muscle mass.
She shares some amazing stories of individuals in their 60s, 70s, and even 80s who have successfully reversed frailty and improved their quality of life through resistance training.
That's so inspiring. It gives me hope.
Me too. And it doesn't have to involve intense powerlifting from the outset.
Right. Even starting with body weight exercises and gradually progressing to using weights can make a big difference.
Exactly. It's about finding what works for you and being consistent.
Now, for those of us who are already incorporating workouts into our routine, what does Dr. Wright suggest is the most effective approach for building muscle?
Well, it depends on your goals. Generally, using lighter weights with higher repetitions in the range of 12 to 15 is better for hypertrophy.
Hypertrophy, that's the increase in muscle size, right?
Right, but for maximizing longevity and maintaining power and strength as we age, she recommends incorporating lower repetitions around 4 to 8 with heavier weights.
Oh, okay, so it's not just about getting bigger.
No, it's about building functional strength that will serve us well as we get older.
And for women, as estrogen levels decline, lifting heavier is especially important.
Yes, it provides that necessary anabolic stimulus for muscle growth.
Got it. So building and maintaining muscle is doing a lot more than just making us look good.
Absolutely. Dr. Wright actually refers to muscle as a metabolic endocrine organ.
What does she mean by that?
It has to do with the impact of muscle contraction. When our skeletal muscles contract during exercise, they trigger the release of beneficial proteins.
Oh, wow. So it's like our muscles are communicating with the rest of our body.
Exactly. And one notable protein that's released is called clotho.
Clotho.
It's often referred to as the longevity protein.
Oh, wow. Why is that?
Because it circulates throughout the body and exerts protective effects on various organs, playing a role in cellular repair.
So simply moving our bodies in ways that challenge our muscles is contributing to our longevity at a cellular level.
It really is. Studies have even shown that older athletes tend to have higher circulating levels of clotho compared to younger individuals who are sedentary.
Wow, that's incredible.
It is. And Dr. Wright also mentioned another fascinating protein released by muscle called irisin.
Irisin. Okay.
Sometimes it's called the exercise protein.
What does it do?
It has positive effects on both bone and fat metabolism.
Oh, cool.
It even promotes the conversion of white fat into brown fat.
So the less metabolically active white fat gets turned into the more energy-burning brown fat.
Exactly. Pretty amazing, right?
It is. So prioritizing muscle health is important for so many reasons.
Absolutely. It's crucial for healthy aging and overall well-being.
And when it comes to supporting muscle growth and maintenance, Dr. Wright emphasizes the importance of adequate protein intake.
Right. She generally recommends aiming for around 1 gram of protein per ideal pound of body weight.
Okay, and with a focus on high-quality protein sources that are rich in leucine.
Exactly. Leucine is an essential amino acid.
And dairy, particularly whey protein, is an excellent source of leucine.
It is. Now, what about supplements?
Yeah, Dr. Wright briefly touched on creatine, which I think many people still associate with bodybuilding.
Yeah, there's a lot of misconceptions about creatine.
So what's the real story?
Well, Dr. Wright highlights the growing body of research that supports creatine supplementation for both men and women.
And it's not just about muscle growth.
Right. She suggests that a consistent daily dose of around 5 grams can be beneficial for maintaining muscle mass and strength supporting cognitive function and even brain health.
Really? So it's kind of a multitasker.
It seems so, and Dr. Wright emphasizes that the idea of creatine being solo for bodybuilders needs to be updated.
It seems like we have a lot more agency over our health span than we might have realized.
We do, and Dr. Wright is really passionate about empowering people with this knowledge.
She even discussed the link she's observed between bone health and Alzheimer's disease.
Yeah, that's really interesting.
It is. So what did she find?
She's noticed a correlation between individuals with lower bone density and a higher incidence of Alzheimer's disease.
So could taking care of our bones potentially reduce our risk of Alzheimer's?
Well, the exact mechanisms are still being researched, but Dr. Wright suggests that it may be related to the communication pathways between bone and the brain.
Perhaps involving some of those signaling proteins we discussed earlier?
Exactly. It highlights another reason why maintaining strong bones throughout our lifespan is so important.
And bringing all of these interconnected pieces together, Dr. Wright emphasized the critical link between metabolic health, particularly the state of prediabetes, the hormonal shifts of menopause in women, and an increased risk for developing both type 2 diabetes and Alzheimer's disease.
Right. The metabolic changes that can occur during perimenopause, coupled with the insulin resistance associated with prediabetes, can create a synergistic effect.
Potentially leading to a higher risk of developing type 2 diabetes and down the line Alzheimer's disease.
Exactly. It really underscores the importance of addressing our metabolic health proactively and early.
Ideally within that critical decade of our 30s and 40s.
Right, to build a foundation for long-term well-being across multiple systems.
It's fascinating how interconnected everything is. Our bones, our muscles, our metabolism, and even our brain health.
They're all part of the same complex and dynamic system.
And Dr. Wright's work is really shedding light on how we can actively influence the system to live longer, stronger, and healthier lives.
So to sum up our deep dive today, we've explored the significance of bone health and its connections to muscle strength and cognitive function.
We've examined how our lifestyle choices impact our musculoskeletal health throughout different life stages, from youth through breastfeeding and menopause.
And we've highlighted the vital role of muscle mass, not just for physical strength, but for metabolic health and longevity.
And from Dr. Wright's insights, some really actionable takeaways have emerged.
Like what?
The importance of incorporating impact exercise into our routine to build strong bone density.
The need for sufficient calcium intake, especially for breastfeeding.
The benefits of engaging in resistance training at any age.
The significance of adequate protein intake and the potential benefits of creatine.
The critical decade between 35 and 45 as a key time to establish these healthy habits.
And the overarching interconnectedness of our musculoskeletal health with our overall well-being, including brain health and metabolic function.
Absolutely. So given the profound impact of these seemingly silent tissues, our bones and muscles, on our long-term health and cognitive function, what small but consistent lifestyle change will you commit to prioritizing starting today?
That's a great question for everyone to consider.
It is. And for more in-depth explorations into the science of longevity and practical tips for optimizing your health, be sure to visit 1337podcast.com for more.
Thank you for joining us for this deep dive.
See you next time.
Strength and honor. I am Spartacus.
Thanks for watching. Tap into 1337podcast.com.